coordinator for Hope. I just want to tell you that this program will be recorded. You will not be seen in the recording. The speaker is going to be spotlighted, so it's only going to be the speaker that you're going to see. So don't worry. If you have any questions, please write them in the chat. It goes much easier if we can keep all the questions in the chat and answer them at the end of the presentation. And please mute yourself during the presentation so that no background noise can disturb our presenter. So it's wonderful for me to be able to introduce Nathalie Houle. Nathalie has been an occupational therapist for 25 years and has been specializing in cancer rehab. She's involved in teaching topics related to cancer rehab to rehab professionals from the University of Montreal and from the University of Sherbrooke. She also gives webinars, as she is today, to patients in relation to cancer rehab. Nathalie is also very involved with Hope and Cope and has given presentations to our newly diagnosed breast cancer group and also to our Focus on the Future program. So Nathalie, the floor is yours, and I'm sure you've got some wonderful knowledge to share with our participants.
Thank you. So I will start by sharing my screen with all of you. Here we go. So everyone can see my slides. Yes. Okay, so we'll get started. So good morning, everyone. I am very pleased to be with you today. So thanks to Hope and Cope for inviting me today. And I am particularly happy to see that this event, this webinar, has generated so much interest, but I think it only reflects the need for cancer patients and cancer survivors to really receive more information about this very distressing symptom. So hopefully this webinar will, help you understand more about the scope, of that symptom. And most importantly, I really hope that you will learn some strategies to help you manage this condition in your day-to-day activities. So today, what I'm hoping to cover, I usually have a very ambitious plan because I want to share as much knowledge and information with you as possible. So there's actually, a lot of different topics that I'm hoping to cover today. But just to give you a little bit of an idea, what we're going to cover is we're going to start looking at, what is cancer-related brain fog, some of the definitions and the symptoms of this condition, and also how it impacts day-to-day activities. We will also explore some possible causes and risk factors for this side effect symptom. And the second part of the talk today is really going to be more about strategies, so really practical tips and solutions to help you manage that specific symptom. And I am planning to finish around like 12:20-ish and to give you time to ask any additional questions that I may not have answered in the webinar, or I may not have been able to answer, after the chat, because as Hinda was saying, please write down your questions on the chat as we go along, because of the high number of participants, I think there's going to be a more efficient way. So don't hesitate, because I don't want you to forget about your questions along the way. And then at the end, we'll look at the questions in the chat. And then if there are still other questions that you may want to ask live, then no problem. But the chat will be the preferred method for asking questions today. So this is the plan for today. I hope that it will cover all your the areas that you would like to learn more about. So we'll do a little bit of history. So I think it's cancer, cancer-related cognitive dysfunction is a symptom that is much newer to our practice, and a lot more research is needed. And there's still a lot of questions that remain unanswered. And I'm hoping over the next years that we will start to get more and more answers about this condition. It was initially reported and studied more with the breast cancer population. And at the beginning, it was very strongly associated with chemotherapy. That's why you may have heard the term chemo brain or chemo fog. And if you look at articles of like maybe 15 or 20 years, then really at that time, they were talking more about chemo brain and chemo fog. However, as years, have passed by and then more studies were done, we know now that cancer-related cognitive fog or dysfunction or difficulties are really associated not only with chemotherapy, but with other cancer treatments. With the cancer itself, it has a lot of different causes that we will look at more in depth in a few slides. So I just wanted to bring your attention that now the terminology is changing a little bit. So if you look at more recent articles, then we will see terms more like cancer-related cognitive decline, cancer-related cognitive impairment, cancer-related cognitive dysfunction, or brain fog. So I think we're starting to see that it's becoming a lot more general and not just linked with like one specific treatment. Okay. So probably one of the first questions that I get asked is what is exactly, cancer-related brain fog? So as the research is emerging, there's still a lot to be done in that field. I cannot give you like a formal, definition that that has been kind of produced. But what I can tell you is that it's definitely a cluster of different symptoms that we will be exploring together. And it's really like cognitive changes that can happen before, during, or after cancer treatments. And one of the things that is important to remember is that it is a real symptom. It's a real condition that it's really becoming more and more recognized. And it's no one's fault. It's definitely, if you're a cancer patient or a cancer survivor, it's not your fault, and it's not something, there's nothing you could have done to prevent this, from happening. And it really can have a devastating impact in your day-to-day life, but it's very difficult to understand for everyone around you because it's not necessarily something that is very visible. So it's very hard to understand, even for healthcare professionals and for your family, your work colleagues, your employer, your friend, etc. And the other thing I wanted to add is that everyone, will have different symptoms. So the symptoms will vary from a person to another person in terms of their severity, and also in terms of where, when it happens in the cancer trajectory. Because as I was saying, it can happen before the start of the treatment, during, or after cancer treatment. So that's also something important to kind of remember. And as I was mentioning, it remains largely unreported, underdiagnosed, and it's definitely something that when I give, lectures, I get a lot of question about that. There's really a need for people to receive more information about that. So I think as healthcare professional, we also need to get better at screening, evaluating, and really guiding people who are living with this. So basically what we're going to do now is I'm going to give you a little break from my voice already, because I want to share with you some of the comments that I've heard over the years from cancer patients or cancer survivors, because they were really trying to explain how this symptom was impacting in their life. So this is kind of a little kind of summary of all the comments that I've heard over the years. So I'm just gonna kind of slide down, scroll through the slides, give you a few seconds to read each of the comments. And usually when I have a live, I mean, it's a live audience, but I mean, when I have people directly in front of me and I can see their reaction, I usually, when I go through those comments, people like, there's a lot of nodding in the room because people really recognize themselves with some or all of the comments. So, so I'm going to stop talking and I'm going to just go down some of those comments. So thank you for going through those comments with me. Like I said, some of you may, it may resonate, I think that's the right word, with some of you. Resonate, I think. Anyway, so basically what I'm going to do now is I'm going to take all those comments that we just read and kind of put them in different categories of what we call cognitive skills. So basically, people usually report that they get easily distracted by what's happening around them. So noise, for example, or just people walking around. And they also get distracted by their own thoughts and their own worries and find it very difficult to actually complete a task, which can be extremely frustrating. There's also been a lot of reports of people having trouble focusing, concentrating, for example, following a conversation and taking in what you're reading. What I've heard a lot in the last few years too is that people are telling me, like, I feel I'm not the same person anymore. I used to be so good at like planning, organizing. I feel like I'm so much more disorganized than I used to be, which, makes people feel scattered, less efficient, taking longer to do tasks. So that really affects the self-esteem. And also people forget appointments, for example, or taking their medication, and all the day-to-day stuff becomes very challenging. The multitasking is also something that I hear a lot. Multitasking is being able to do more than one thing at the same time. And we do that all the time, all day long, doing several things at once. And we live in a society that kind of encourages that, like productivity, efficiency, being able, the more you can do at the same time, the better. So not being able to do that, it's very, very hard, because that's, we have to do that all the time. So very, very difficult. And one of the biggest complaints is, difficulties with the memory. It's probably the most common difficulty that, people are reporting. And also finding their words. So, what I hear a lot is that, I find that, the words are at the tip of my tongue, but I can't find them. And people get a sense of like a mental fog, a decreased sharpness of their brain. So everything takes longer. And, one thing that I really wanted to focus on is the mental fatigue, because what we know now is that people going through cancer treatments, or who have completed their cancer treatments, basically the cancer is not affecting just locally. It's not just affecting the site of the tumor. It affects your whole body. It affects everything. So there's been a lot of studies looking at images of the brain. And now we know that people going through cancer, they have to work harder, basically. So their brain has to be activated more to do tasks that are simple. So that means that cancer patients and cancer survivors are working more. Their brain is working more to function, to go through everyday activities. So no wonder the fatigue is more important. So that's really something that I wanted to kind of emphasize today, because it's really kind of a discovery. I find it changes a lot of things, and it explains a lot of things. So hopefully, we've covered a bit what is cancer-related brain fog. We've talked about really the symptoms. So hopefully, the fog might be starting to clear out for you in terms of like what it is, and information to better understand it. Because the more you know about it, then the more you can adapt to it. So what we know, because there's still a lot that we don't know, and there's still a lot that we have to kind of learn more about. So like I was mentioning, it's certainly not the person's fault. It is very, very real. It's not a sign that the cancer is progressing. It's not a sign that the cancer is coming back, that the treatments are not working. Doesn't mean that you have mental health problems. And it doesn't mean that, you have what we call a neurocognitive disorder, such as dementia. It doesn't mean any of that. And as I was saying at the beginning of the presentation, it's been studied more with the breast cancer population, but it can affect people with all types of cancer. And it can start before, during, or after the cancer treatments. And we'll look a little bit more at, in terms of like statistics, how much, how many people are affected by it, like before, during, and after treatments. And it's quite high. In some cases, it can persist for months and years after the completion of cancer treatments. And we'll look at that in a few seconds, in what proportion. It's something that is very hard to evaluate. It's especially even with more specialized evaluation like neuropsychological testing, because those remain subtle change objectively. So if we try to measure them with specific tests, and there hasn't been really like an evaluation battery and evaluation tools that have been designed specifically to like measure, evaluate people with cancer related cognitive dysfunction. So it's very hard. And as we're going to see, there's many possible causes too. So it's a very difficult area to study and evaluate. It has significant impact in day-to-day activities. It could be household chores, childcare, work, relationship, leisure, everything can be affected. And the rest, I've kind of covered that already in the previous slide. So I will go to the next one. So I've been giving lectures on that topic for a few years now, and for me, it's still a shock to see those numbers. It's still a shock to see those statistics, because I really feel, because I've been working in this field now for a few years as well, that there's an unmet need. And I'm always surprised that there's so many people affected by it, yet there's not a lot of information out there for people, to reassure people and to give them information about how they can adapt to it. So already, because the cancer itself is a cause of cognitive dysfunction, up to 30% of patients will experience some form of, cognitive dysfunction before the start of any cancer treatment. And up to 75% can experience those difficulties during the treatment. So during the treatment is really the period where most people will kind of be affected by it. And as I was mentioning before, and I know it's always a little bit of a shock, and people, it's very hard for people to hear that, around a third of the patients will experience those symptoms even after the end of the treatment. So it can, for months, 1, 2 years, sometimes more. However, in general, it gets better with time. So please remember this, it gets better with time. And as you know, the treatments, and it gradually gets better. But like I was mentioning, it doesn't affect two people the same way. So for some people, it will linger on a bit longer, and some people, it will kind of get better faster. And like I was mentioning, there's not really, there hasn't been, there's more research that is needed really to determine more specifically how long it can stay and what percentage of people are affected for 6 months after, a year or 2 years or more. So hopefully, like I said, in the next few years, we'll continue to get more information about that. The possible causes and risk factors. So again, many causes, as I was telling you about before, cancer itself. So that explains really that a significant number of people will be affected by it even before any treatments are initiated. And it's not just linked to chemotherapy anymore. It's linked to other cancer treatments, such as, radiation therapy, immunotherapy, targeted therapy, hormonal therapy, and hormonal changes. Even a surgery, the stress of a surgery to your body can affect your cognition. And let's face it, so usually, someone during their cancer journey will have not just one treatment, will have usually different treatments given together or one after the other. And then we also know that surgery is often part of the treatment plan. So you put everything together, and that kind of starts to explain how cognition can be really impacted, sometimes more in some people who are receiving high doses of chemotherapy over a more prolonged period, or people who are receiving lots of different treatments over a longer period. And another thing that I would like you to kind of remember from this session is that there's a lot of other symptoms and side effects from the treatments that can affect cognition, such as fatigue, pain, anxiety, depression, and problems sleeping. So if you find solutions and strategies to manage and decrease those symptoms, automatically the cognitive skills and the cognitive functioning will get better. So everything is kind of linked together. So that's really something that I'll talk a lot about today. And there's also other health problems that people can develop during the treatments that can alter the cognitive functioning, such as anemia, which is quite common, unfortunately, during the treatments, and also different kinds of infections. And medications too, which is, you know, part of the treatment plan for most people. And there are certain categories of medication that are known to affect more cognition than others. For example, painkillers, sleeping pills, or anti-nausea, for example. Lifestyle. So what I mean by that is that if a person is very sedentary, doesn't do any kind of physical activity, which obviously is not recommended, because there's a positive association between physical activity and cognitive functioning. So really, physical activity should be encouraged. And also, if someone, going back to the lifestyle, if someone has like bad sleeping habits leading to more sleep problems, that also can affect the cognitive skills. There's a possibility of a genetic link, but more research is needed for that. And as people get older and get into, for example, their 70s and their 80s, then they become more fragile and vulnerable to cognitive changes during or after cancer treatments. So we see that a lot with older patients. And also, people, some studies have showed that people who had poorer cognitive reserve, they might be a bit more vulnerable to cognitive changes. And just so you know, cognitive reserve is a concept that really refers to the brain's ability to cope with some damages and still be able to function adequately. So it's kind of the ability of your brain to compensate for some changes. And the cognitive reserve can be influenced by the lifestyle, so the education level, and also the type of occupation that they were doing as well. So as you can see, it is not a simple, it is not a simple problem to address. It's very complicated, multiple causes and risk factors. We won't go into, this slide in a lot of depth, because it's pretty hardcore. It has a lot of complex information, but it was just to kind of continue in the same line of thoughts, just to illustrate that cognitive function is impacted by so many things. So everything I've said so far, so how a person feels emotionally will impact. Same thing for the fatigue, other health problems, the cancer itself, possibly genetic link, the lifestyle, and we could continue to add to it. So there's, the good news is that some of those factors, we can act on them and we can modify them. So as I was mentioning earlier, and I've said that a few times already, this condition will have a significant impact. And again, usually when I have, an audience in front of me, I see a lot of, nodding and people telling me, yes, definitely. So it's a negative impact on the quality of life. It can alter everyday functioning. So all your activities will be affected, can be affected. And as I was saying at the beginning of the presentation, it's associated with a high level of distress, anxiety, frustration, decrease in the self-esteem, the self-efficiency, and it generates a lot of fatigue as well, because your brain has to work harder. And it really affects your relationships with your family, with your friends, because it's really something that it's hard to understand for other people, because it's kind of invisible for them. And usually the person who's affected by it tries to compensate, but has to work so much harder. It's like a marathon to arrive to the same line as other people. And it's often reported as one of the main obstacles to return to work, like fatigue. Fatigue is another big barrier for a lot of people in terms of return to work. So when I was initially preparing for that presentation, I wasn't sure if I was going to have a large number of healthcare professionals who were going to join. So I included some information about how to screen and evaluate, because usually healthcare professionals, that's what they like. They like to have tools to how can we evaluate, how can we screen. I decided to leave those slides, even if I know today, it's mostly people who are going through cancer treatments or who have completed their treatments. And I know that I have a lot of, staff and volunteer from the Hope and Cope Center. I still left those information and the link, because they're not exclusively reserved for healthcare professionals. You can go and have a look at those tools, because over the years, I have to say that the people that I've, because those are questionnaires, they're basically questionnaire that I ask my patients to fill in. And usually when I do that, my patients actually, they do enjoy completing those questionnaires, because it really kind of put words on the difficulties they've been experiencing. And it can also help you to prepare for your appointments with other healthcare professionals, because it gives you examples really on how it affects your day-to-day activities. So you can go and see your healthcare professional and say, like, look, I have issues with this, this, and this. So it's a way that you can prepare for to get some help, to have some really examples. And this is only one page. If I remember correctly, that questionnaire is at least 3, if not 4 pages. And I wouldn't necessarily advise you to try scoring it, because the scoring system is very complicated, but just filling it out like this and just see how, where are your biggest challenges. And what I usually do too is this is something that I go through with my patients at the beginning, and then after, at the end of education sessions that I've done, to see if the strategies that we've implemented have been working. And the scores, usually improve significantly, which is very encouraging for me, of course, but also for all the patients that I've been working with. And something I was saying at the beginning, very, very, very important, is that all the other symptoms like fatigue, pain, anxiety, distress, sleeping problems, all of those need to be looked at. If you feel that it's also something that you're suffering from, then again, additional questionnaires that you can use to yourself understand more the depth of the problem, whether it's fatigue or whether it's sleeping problems, and you could bring that to the table when you meet with your healthcare team. Again, additional tools that can be used more to look at how, your emotional well-being, and also if you're suffering from any sleeping, difficulties. And those questionnaires are really more screening tools, and they're not meant in any way to make a diagnostic, which should always be made by a healthcare professional. Okay, but it can give you some indication about, the scope of the issues, and also how it impacts in your day-to-day activities. So now we're going to the second part, which are strategies to manage cancer-related cognitive dysfunction. So I'm really gonna give you as many, I just pulled out as many strategies as I could find. So hopefully, I'm giving a lot of information today, and I'm going to send my PowerPoint presentation after this. So I think perhaps some of you might want to have it to refer back to it, because there's a lot of different links and additional resources. And I'm aware that I'm giving a lot of information today, so it might be some good to go back to it. And I know it's going to be recorded as well. So feel free to kind of share it with family and friends, because they might need more information about that problem as well. Okay, very important. So we're going to start looking at some strategies together. So again, I wish that I could come up today and tell you, oh, those are the gold standard interventions. So the research has spoken, you know, the specialists have spoken. This is exactly what you have to do to treat it, and it will improve. It will go away. Unfortunately, I'm not the bearer of such good news today. There is no gold standard interventions to this day, and I'm hoping, you know, there's going to be more research that will shed some light on what is more effective than other, but there are some things that we know already, and I'm going to go through each of them in a little bit more depth in a few seconds. So we're going to start with physical activity. So we all know the benefits of exercise for cancer patients and cancer survivors. Obviously, as long as it is something that you've been cleared for by your healthcare team and that there's no restrictions that apply to your specific situation. I just wanted to share that that graphic with you that is actually coming from the American College of Sports Medicine, and they have created special guidelines for exercising for the cancer patients and cancer survivors, and it's evidence-based. So really, there's a lot of benefits, and I wanted to share that with you because, as you can see, I've spoken about the different factors that can impact negatively your cognitive skills. And very interesting, we see that physical activity will definitely have an impact in reducing cancer-related fatigue. Actually, is the most efficient, most recommended strategy for cancer to fight cancer-related fatigue. It will also improve quality of life, physical function, and decrease anxiety, depression level, etc. So automatically, it will cascade down to also improving your cognitive skills. So definitely physical activity recommended as long as cleared by your healthcare team. And also the National Cancer Comprehensive Network has also recommended physical activity as a management strategy for cancer cognitive related dysfunction. I just wanted to talk a little bit about fatigue because fatigue and cognitive functioning are like very, very close, very related. So one of the first things in managing better the cognitive dysfunction and fatigue, whether it's physical, mental, or both, is really try to understand more about your fatigue level, meaning that you have to listen to your body and really listen to yourself where you're at in terms of energy level. And some people use different pictures, different analogies to really understand themselves better. So you can see your energy level as maybe traffic lights. So green, you're good, you're feeling, you know, good energy level, you feel that you can continue, you're okay. Yellow means that you should think, you know, you should stop and you should take a break because you're feeling that your energy is going down. But if you look around you in the traffic, that's not what we're seeing in general. When it's yellow, people don't stop. They don't slow down. They usually go faster to get through the other side. And I see that a lot in real life. And there's no advantages in going over your limit in terms of like energy and fatigue, because if you go beyond your limit, then it's going to take you way longer to recuperate from it. So it's better to stop before and take a break before, and then you will re-energize more quickly. Other people, they like to think about their energy level like a battery. So really, you need to recharge before there's no battery left, because if you think about your cell phone, you know, you always need it. There's always an emergency when there's no battery left, right? So you always need to keep that energy, some energy level for emergency. So think about recharging. Same thing with the bank account. The energy, if you just withdraw your money all the time, there's going to be nothing left. You need to make deposits. So what is a deposit for you? What enables you to recharge your batteries physically and mentally? So you need to think about that and try to kind of rediscover yourself and think, okay, what gives me my energy back? So very, very important. And also another theory that is also very interesting, it's called the spoon theory. And it's a theory that's been designed for people living with a chronic condition who were experiencing significant level of fatigue, to kind of explain to their friends and family, look, you may have unlimited amount of energy. I don't. I have a limited amount of energy every day, and I have to plan how I'm going to use it if I want to get to the end of the day. And depending on the activities that you choose, some will require more spoons and some will require less. So it's going to be important, and I'll talk about that in a minute, to alternate activities that are more, physically challenging or mentally challenging for you with activities that you find are not so demanding. Because if you just do activities that require 3-4 spoons back to back, that is not going to work. So some energy conservation principles that I'll go through that quickly because they are pretty logical, basically. But prioritizing is very, very important because, as you can see, because of cognitive difficulties, people, they're not able to do things as fast as before. They might not have the same efficiency level. So they really have to prioritize and think, okay, what do I really need to do today? What is important that I do? And does it need to be done today? Can it be done tomorrow? Can it be done at the end of the week? So really prioritizing what needs to be done, and also keep time for something that you enjoy, putting yourself first, and always leave time for something, that is pleasant, that enables you to recharge your batteries. And set yourself small and realistic goals, because hopefully at the end of this, you will see that, this is actually quite a significant symptom, and is, it's not your fault. It's not something you could have done anything, and you have to work so much harder to get through your day. So people should actually, praise themselves and celebrate their successes, because the energy that is spent, it's so much more when someone is going through cancer or after cancer treatment. So very important. Be kind and patient to yourself, because definitely deserved. I was mentioning alternating tasks that takes a lot of energy with those that take less. So the importance of planning your day, planning your week, planning your month, to really alternate periods of, doing and resting. People don't have to rest for 3 hours. They can just rest for, sometimes a few minutes is enough, like we call it micro breaks. So it's really kind of finding what's the right pace for you. Delegation is also a really good strategy, because sometimes your friends and your family, they want to help, they just don't know exactly how. So identifying the things that are more challenging for you, perhaps this is something someone else can do for now. And again, pacing, I talked about that. So really pacing activities and stop before you get too tired, before you go over your limit. So those are just general principles that I wanted to go through with you today. And I was talking about activities that will bring you back some energy. So there has been some interesting studies and research and some positive association between like cognitive functioning and different activities such as meditation, yoga, tai chi, directive breathing, mindfulness, physical activity, and also spending time in nature. And again, there's so many apps now, so many resources on the internet if you want to kind of start meditating or directive breathing. There's so many resources on the internet now, so many apps that you can use, and some of them, most are free, some have a free trial. So it's worth exploring and see what works for you, because stress management is very important for everything, for fatigue management, sleep, and also cognitive functioning. Taking care of your sleep and having good sleeping habits is also very important, very, very much so, because if you're not sleeping well, then you will be more tired, and cognitively it will be more difficult as well. So those are just kind of general principles, but it's important that basically your bedroom is a place that you look forward to be, you look forward to sleep, and that when you kind of get into your bed at night, you have like a few seconds of like pure pleasure. So if there's a room that you should invest in, is your bedroom. So really curtains that, you know, or blinds that are really kind of blocking the light, so it's dark in your room, sheets that are, you know, super comfortable, invest in a good pillow, and the temperature ideal, it's hard to, you know, it depends, so really it has to be the right temperature for you, depending of other symptoms or side effects that you may be experiencing. Physical activity is good. However, physical activity that is too strenuous in the evening before going to bed, like a little walk is fine, but just too physical activity that is too intense will not necessarily prepare you to go to sleep. So it might be better to do it earlier in the day. Any kind of drinks with caffeine should be taken really no later than the beginning of the afternoon, because the caffeine will stay in your body for many hours after consumption. So really beginning of the afternoon should kind of be the last caffeinated drink. Alcohol and smoking also, you know, not very conductive to a very good night's sleep. And have a routine and really kind of prepare a relaxing routine before going to bed. So you're kind of telling your brain that it's time for bed, and avoid screen exposure in the hour before going to bed, because the blue light can affect your sleep, because it affects also the production of melatonin, which is a hormone that is essential as well for sleeping. So those kind of, and avoid like heavy meals just before going to bed. But again, going to bed hungry is not better. So perhaps a light snack if you're feeling hungry, but nothing that is too heavy before going to bed. And maybe have a period in the day that you can write maybe the issues that you're worried about down, so they're not turning in your head when you go to bed, because often people go to bed and they just think and think and think, and it prevents them from falling asleep. So we'll continue through because I see the time. So I'll go quickly in the next few slides. So napping recommended, but it should be shorter naps, like power naps, and they should be taken before 3 p.m. in the afternoon, because later than that, it will interfere with your nighttime sleep, and they should be the shortest possible. So definitely no longer than an hour, and taken before 3 o'clock in the afternoon. And this, you can refer back to it, but it's really things that you can read and see what works for you. We call that external and compensatory strategy. So you have to compensate for the areas of your brain that may working less well at the moment. So you have to find helpers. So you have, for example, whatever works for you. Some people prefer paper version, whether it's Post-it, whether it's a calendar, whether it's an agenda, and some people prefer working, with their smartphone, electronic reminders, and using different applications. So I've put down a few applications that help people get organized, but there are many more. So it's really kind of exploring what works for you. You can take a picture when your smartphone, for example, when you're parking your car somewhere and you don't want to forget. To-do lists, calendars, timers, especially, for example, when you're cooking, because you don't want to forget that you put something to cook. So definitely use timers when you're cooking. Involve family and friends. So give them education about cognitive dysfunction, and they can also send you a reminder. Organize your day and your environment. So things should be put away after use, and you should have a special place to store commonly used objects such as keys, wallet, glasses. Try to do really one thing at a time. Very, very important. For driving, use GPS or other applications to find your way and help with driving, such as Waze. For medication management, some people try to use a pill box or a disc pill and then put it always in the same place, and then setting alarms on their phone to remind them to take their medication at specific times. And really try to reduce distractions as much as possible. And you can also, when someone's giving you information, you can take notes, but also repeat the information to yourself and talk to yourself, really, to kind of go through the information that you don't want to forget. And get support, very important. Talk to your healthcare team if you're experiencing cancer-related cognitive dysfunction, because they can help. Everyone can help in their own way to help you manage cancer-related cognitive dysfunction. And really, especially if it's associated with high level of distress, really, it's important to talk about it, tell your friends, your family, and learn to delegate, as I've mentioned before, and be kind and forgiving to yourself, because your brain is working harder. And this is I just wanted you to know that this website exists and it's a good resource. It's called Cancer and Work, and it was really designed to address the unique needs of cancer survivors when they're thinking of returning to work. So really for people that are going through treatments or cancer survivors, they would go into this section, I am a cancer survivor. And then if you look here, you know, what I find particularly interesting is the section on cancer's impact on work and strategies. And then if you look at that, and then you choose cognitive challenges, then it gives you additional information. And then on top of that, it gives you practical tips on how to make it easier when returning to work if you're experiencing cognitive challenges. And we also have other resources that can be that you can refer to. There's some booklets that have been done specifically for people experiencing cancer-related cognitive impairment. So I think that I have covered all the things that I wanted to cover, going a bit more quickly with some areas than others. So I think I'm gonna stop sharing my screen, and I'm going to ask my assistant for today, hello, to maybe I'm gonna to see because I think the chat was quite active.
In all of my webinars,
Yeah?
at Hope and Cope, this is the most active I've seen the chat.
Yay.
Most questions.
Okay,
so I'm
great.
going to go through them. I'm going to preface by saying I am not a medical professional, so it's possible that you answered some of these questions. I'm going to go through all of them. If you have answered them, just tell me you've answered them, because I know a lot came in at the beginning before your presentation. So also just for everyone asking about the presentation, we have recorded the Zoom session. It will be posted on our YouTube. And also Nathalie mentioned that she would be sending the presentation. So what we can do, Nathalie, if it's okay with you, that whoever came today will get an email from either myself or Liz with a copy of the presentation, where you can also access the links. So one of the first questions is, I have heard that sometimes brain fog doesn't go away after treatment. Is this true? And if so, is there anything I can do to prevent it?
You answered that question. It was mine.
Okay, perfect.
Oh yeah, okay,
Thank
perfect.
you.
So I'm
Thank
glad
you,
if you feel
Erica.
I've answered. Perfect.
Someone asked, does brain fog feel like your brain can't compute? Which I think you also answered. And then also that that brain fog is connected to other cancer treatments other than chemo.
Yes.
In terms of the specific questions that ask about the medication, I'm going to ask that you speak to your medical team about that. I don't want to discuss certain medications that might not be applicable to the group. Someone said, as I look at the symptoms, 4 of my friends became widows recently, and most of them, if not all the symptoms listed, apply to them. So it's also what Nathalie said, that something like stress can cause brain fog. Brain fog is something that is applicable in many different situations, not just to cancer patients. Marcel asked, could it be related to the distress? So exactly what Nathalie was saying, it could be related to treatment, stress of surgery, the uncertainty. Another question about the medication, I'm going to ask that you would refer that back to your medical team.
And I wanted to add, because I see that there's a comment here in the chat about people going through different dramatic life events, and brain fog is not exclusive to cancer. It's actually a condition that is associated with other health conditions like multiple sclerosis, lupus, fibromyalgia, and definitely when people are going through some major life events, it's affecting them emotionally, thus affecting cognitive functioning as well. Yeah. So interesting comment here. Yeah.
Is there any research on the benefit of CBD full spectrum oil?
Do you know what time that that question was asked?
12:24.
12:24. Let me see. CBD full spectrum. Not to my knowledge, but I certainly have it in all the articles that I've read. I don't remember seeing any reference to it, but there's always new things coming up, so it could be, but not to my knowledge. Not to my knowledge. No.
A lot of people just saying thank you and that the presentation was amazing. Any evidence to suggest neurocognitive testing before cancer treatment, similar to preventative testing like heart echo, lung testing, such that there's a personal reference frame to compare with future neurological testing?
That's a very interesting question. So all the questions are very pertinent and interesting, I find. Yeah, I think the difficulty too in identifying cognitive impairment is because we have no baseline, if we had a baseline of the cognitive functioning of the person before the cancer even started, then it would be easier to monitor. So I think that's where the research is slowly going to start evaluating people, but I suspect that it may start with more people that are more vulnerable to cognitive changes. So for example, seniors. So I think maybe that's where the research is going. And because we've seen that 1/3 of the patients actually have cancer-related cognitive dysfunction even before the treatment starts, then, to have an accurate baseline, we would have to go back as far as before, like even before the first symptoms are there, or even before the cancer is present in the body, which is impossible to kind of do. So that's why it's a very hard domain, but definitely it's always useful to have an evaluation before, and we call that pre-rehab, which means like the rehab before, and there's a growing body of evidence showing all the benefits of pre-rehab, and that there's so many interventions that could be done before the start of the treatment, like physical training, education on nutrition, et cetera, cognitive, like evaluation, also neuropsychological testing. But unfortunately, as I was mentioning before, it doesn't always pick up the subtle cognitive changes. And the research is showing that actually what kind of shows more the impact is self-reports. It's really people filling in questionnaire about how it's affecting their daily life, more than like objective testing, because those changes are so subtle, it doesn't always get picked up. And if we had special tests specifically designed, it would be great, but we're not there yet at that level. So yeah, very.
Thank you. And there was another question. Someone like rephrased their question in a better way that I understand. Someone wants to know about brain fog has a layering effect. So if someone received chemo and then radiation and then went through menopause and is now on anti-tumor meds, do those kind
Yes.
of layer together?
Yes, absolutely. Same thing for the fatigue as well. The research is showing that, you know, the more different treatments that you get, and on top of surgery, medication, then the more at risk, because it kind of adds up. You know, the more susceptible you might be to have cancer-related cognitive dysfunction. Yeah.
So kind of a similar question that just came in is, we know that menopause can also cause similar symptoms. Is there any research about the link between menopause and brain fog and treatments?
What we know is that hormonal therapy and hormone changes, like, you know, during menopause, also has been linked to, you know, cognitive dysfunction. So definitely also because sometimes when people are going through menopause, there's a lot of other, you know, different symptoms, like sleep can be, you know, disturbed plus. And so that also kind of, you know, impacts. So definitely, I would suggest to everyone who's experiencing like cognitive difficulties to talk about their healthcare team, because depending on where they're at in their treatments and the different symptoms that they're having on top of the cognitive functioning, yeah, there might be, you know, there's no specific medication, unfortunately, that's been approved for cancer-related cognitive dysfunction, but there can be medication to treat the side effects or the other condition that are contributing to cognitive dysfunction. Hope it answers the question.
I think so. Another question that just came in is, will brain fog due to cancer treatment develop into Alzheimer's or dementia?
There's no evidence for that. No, there's no evidence that it will kind of that it's a risk factor for, you know, I haven't, you know, seen evidence for that. So that's reassuring. That's some, you know, good news. Yeah. And it gets better with time. Definitely gets better with time. I think
those are all the questions.
Oh, super.
Perfect. So I just want to say, on behalf of everyone who joined today in Hope and Cope, Nathalie, thank you so much for this presentation. It was so informative, so well organized. You answered even a lot of my questions that I had and that I get from patients about brain fog.
I'm happy.
Just to reconfirm with everyone who joined us today, thank you so much for taking the time out of your day to come. We hope that you found it beneficial and that you can take something from this presentation. We are going to send the presentation. So Nathalie, if you can send either Liz or myself the presentation, what we're going to do is we can send it out to the people who joined us today. And also in the near future, this will be available on our YouTube channel as well.
I see there's a hand raised, Stephanie Doren. Stephanie, we're ready for you. I don't hear anything.
Hello?
Stephanie, hi.
Yeah, sorry.
Hi. No, it's okay. Hi, Stephanie.
I had a question that I put in the comments regarding the demographics. It was in that table that you went quickly. You know, if you have a partner, if you're married, etc. Can you elaborate a little bit about that? Because
yeah, exactly. So so it's more about it, you know, You're absolutely right. Actually, you've kind of answered the question already, because it is true. Yeah, there's been some, some research showing that if someone is, exactly is married, is well surrounded, might be less vulnerable to those type of changes versus someone who's very isolated. And also in terms of the financial situation too, we know that a cancer diagnostic and cancer treatments in terms of like the financial stress, that's a very big, so people who are, their socioeconomic conditions are, more difficult, then it's an even bigger stressor for them. And then it impacts even more on cognition because the stress level is higher. I
We
don't know if
also, oh, sorry.
Yeah,
We just
go ahead,
received
yeah.
one more question, which I think
Yes.
I know the answer to. Someone asked we know it gets better over time. Do we have any idea about the amount of months or years?
I wish, but no. Most of and I'm hoping that will come. But yeah, I wish I would have numbers to give you, like how many people recover within 6 months, within a year, within 2 years. I mean, we know that most people will recover within the next few months, and sometimes up to a year, up to 2 years. It's more rare that people complain about that like several years after the end of the treatment. It usually gets better and resolves, but I have heard of people still kind of, so it does exist, unfortunately, that with some people it does linger on for a longer period, but it's more, it's more rare. So it's a few months going up to 1 to 2 years in general, and that's only for around a third of people that it stays after the end of the treatment. I hope
Perfect, thank you.
I hope I had a better answer, but I hope I've answered your
So
question.
we have one more question that just came in, and I'm going to cap it at this question. If anyone else has any other questions, please email Liz or myself, and we can try and get an answer for you. But somebody asked, do you think COVID is playing a role in brain fog?
Very, very interesting question, for sure, because there's actually now some studies and research coming up to talk about brain fog post-COVID. So now we're starting to see that some people, not everyone, that contracted COVID may be experiencing brain fog. So that's one thing. But even without contracting the COVID, everything is so much more complicated with the COVID. So everything takes more energy, everything has to be more planned, everything has to be more organized. So that, I find, contributes to elevating the stress level, especially for people who are immunosuppressed and have to be, even more vigilant. So the stress, the anxiety is higher because of the COVID for everyone, but especially more for the oncology sector, I would say. So for sure, I mean, it contributes. It definitely. Very good question. Yeah, very good comment.
I think that's a good way to end this presentation. So again, Nathalie, thank you so much on behalf of myself, Hope and Cope, and everyone who joined us today. We look forward to having you back. And we will be sure to send out, just keep an eye out on your emails, on our YouTube channel, on our website. We list many activities, some like this webinar, but we also, as Marcel mentioned, we offer a lot of activities that could have benefits, like Nathalie mentioned. We offer exercise programs, relaxation, Reiki, and we're always here for you. Liz put her email in the chat, so feel free to message Liz for anything, and she can kind of pass it along to the appropriate person. And we look forward to seeing you all again, and have a great afternoon. Stay warm if you're in Montreal.
Thank you.
Thank you.
Bye, everyone.
Thank you.
That was
Merci
wonderful.
beaucoup. Thank you.
Thank you.
good. So Elizabeth,
you,
I will
everyone.
send you my presentation in 2 or 3 minutes.
No problem. I'll send it out to everybody.
Good.